Okay, so I would like to present to you the draft concept paper and therewith ICPerMed's and ICPerMed's view on the European Partnership for Personalized Medicine. Also, this presentation will be available after this event, and you can already have a look on the draft concept paper, well, through the ICPerMed and ICPerMed websites. Okay, so before I go to the document itself, I would like to explain you how this document was developed. And also, Jean-Luc, you already gave an input for this. So it was last year, beginning of last year, when the Commission approached ICPerMed and ICPerMed and asked if both initiatives would be willing to give an input for the European Partnership for Personalized Medicine. And both initiatives decided to develop and establish a preparatory group with representatives from ICPerMed and also from ICPerMed side, and also with participation from the European Commission. And both initiatives, ICPerMed and ICPerMed, also developed supporting groups helping the work of the preparatory group. And the first task of this preparatory group was the development of this draft concept paper that was approved and discussed through ICPerMed and ICPerMed during a joint sustainability workshop in September 2020 and was provided to the Commission in October last year. And since this year, it is also available on the ICPerMed and ICPerMed websites. So you are having the link here also in the slides. And the aim of this draft concept paper is to provide input for the ICPerMed itself, for the consultation of the member states that was just mentioned by the Commission, and also, of course, for the development and the description of the European partnership. That, well, if everything is running in time, could start most probably end of 2023. With the draft concept paper, we also aim to promote the European Partnership for Personalized Medicine and also personalized medicine in general as topic, not only in those countries and regions already participating in ICPerMed or the ICPerMed family, but also beyond. So this is really a great opportunity to promote and to show the importance of the Partnership for Personalized Medicine. The document itself is not the official partnership proposal, and it is not a document that is approved or developed by the European Commission, but it is ICPerMed's and ICPerMed's input for the partnership, and it is building on the experiences of both initiatives. The document is structured around the European Commission template for the partnerships, although we changed a little bit the order to give it a nice flow. And you can see the general structure here also on the slide, and we will go through this later on. We think from ICPerMed and ICPerMed side that personalized medicine is indeed a major opportunity for society to provide benefits to patients and citizens and health systems. And personalized medicine could tackle some key questions. For example, why is a treatment working for one patient but not for the other? Why is it so important to collect all these different molecular, clinical, and lifestyle data for personalized prevention, diagnostic, and treatment, and how all this data could help, well, to avoid health risks and to support healthy life. And also personalized medicine is tackling health economic aspects, as it was also mentioned by the Commission before. So we think that personalized medicine is a prime driver towards optimized healthcare due to its great potential for disease prevention, diagnostic, and treatment. And we think that through this partnership, we can bring together the critical mass that can move forward personalized medicine towards implementation, despite the heterogeneous regional and national healthcare systems that we have. And that personalized medicine in general is of great importance. We can see, for example, through the investment coming from the European Commission in this area that invested since the 7th Framework Program more than 2 billion euro already in the field of personalized medicine. So, for example, but not only in the ICPerMed family and also other initiatives, but also in research funding. So this is an important, an important push for the research in personalized medicine. But we would like to underline that not only personalized medicine approaches are pushed from Commission side, but also a lot is going on regional, national, and cross-collaborative initiatives and actions. So we try to demonstrate these best practice, how we call them, examples through the ICPerMed website. So you can find in a specific section examples of best practice, national and regional implementation approaches, for example, for a certain disease, developing diagnostic and treatment, but also structuring approaches up to national plans that are implemented. So this is really the baseline, we think, to move forward the personalized medicine reflections also on a bigger level in a partnership. And the importance of the topic is also shown in the huge amount of partners, organizations, and countries, different countries and regions that are joining ICPerMed, ICPerMed, and also the different ICPerMed family actions. So you have, for example, more than 30 countries participating already in ICPerMed. What is more a platform to develop a support and to align strategies in the field of personalized medicine. Then you are having ICPerMed, that is currently the largest areanet in the health sector, and with approximately 100 million euro invested in the field of personalized medicine by 2020. And then you have all the different topics also that are important for personalized medicine that receive support currently through the ICPerMed family, as health economic aspects, clinical trial design, but also the importance of international collaboration and the regional perspective. And just mentioned regions, also to show the importance of personalized medicine, you can see this on the huge amount of regions that already have personalized medicine as priority in their strategic agendas. This is especially important taking into account that healthcare is often organized on regional level. We think to improve and to move forward personalized medicine, we have to understand the personalized medicine environment that is strongly influenced by a diverse number of processes, actors, decision makers around the entire value chain. So we think that here in the very center, you have research and innovation. That is the key element to influence and drive forward the development of personalized medicine approaches with the different areas of research and innovation that we just organized around the very center. And in the outer circle, you have the major stakeholders that are important in the personalized medicine environment, responsible for developing, monitoring, and supporting research and innovation. For having finally personalized medicine implementation for the patients and citizens. And in the corners, you are having the decision makers on the blue frame. So they are in the position to set important impulses in terms of funding, framework, infrastructures, and also regulations for personalized medicine. So we already developed a lot in the field of personalized medicine. For example, in the treatment and the diagnostic in rare diseases or cancer, and also already in prevention, so the use of biomarkers for risk estimations. But really to move forward personalized medicine in implementation, a lot more effort is still needed. And we think that personalized medicine, to bring this into reality, we have to work and to support still different crucial actors that are here in this figure mentioned in the green frame. So basic and translational research, education and literacy, policy development, regulation and market access. And to move forward these different axes, we truly have to work in multidisciplinary approaches with all these different fields that are mentioned here in the yellow frames. A lot is already supported currently and receives funding, like biomedical or clinical research, but also data research. We sincerely think that, for example, more effort and funding still has to be provided to social sciences and also to everything that is literacy, education, and training and communication. And for all this, we think that cooperation and investment across Europe, but also beyond, is needed for the personalized medicine implementation, for sharing, harmonization, and dissemination of knowledge, policies, and strategies. And we think that the ICPerMed could be the platform to enable this, to move forward, to bring personalized medicine approaches to the citizens and patients by fostering cooperation among the relevant stakeholders and investment in research and innovation, and also through transversal activities, promoting the development along the 4 crucial axes that are demonstrated here. Well, there are a lot of very successful also initiatives going on, but we think that we need a joint effort. So to bring all these different initiatives together in a common platform that could be the ICPerMed. Because we think that the joint efforts are needed, and the ICPerMed could provide this platform to bring together this critical mass to move forward personalized medicine, to bridge the gap between personalized medicine research and its implementation in health care systems, and also to bring together all the different stakeholders involved in the field in one partnership. So we think the vision of the ICPerMed should be the full implementation of personalized medicine and healthcare to the benefit of patients, citizens, and the society. And our proposition is that the ICPerMed should be built around 5 key elements, with policy and healthcare systems in the very center. So everything that is around setting the right policy priorities, developing sustainable health systems, and also finding the solution to societal, health, economic, and health-related social problems. On the very top, you have the joint funding activities. Of course, it's important to move forward research to successfully go towards the objectives and impact of the ICPerMed. And both are based on education, support actions, and synergies, because we really have to develop the good communication about what is personalized medicine about for health professionals, but not only, also to improve the literacy for citizens and patients, but also for decision makers, funders, and also health policy organizations. And of course, we need to have the alignment of strategies and priority settings. And all these 4 key elements are based on a management and coordination structure that could be provided by the European Partnership for Personalized Medicine. Well, on the next 2 slides, I could spend at least, 30 minutes only on the objectives and impact. So please have a look on the concept paper to really get an overview about the objectives and the impact in more detail. So I would like only to mention that, of course, the overall objective of ICPerMed should be the full implementation of personalized medicine through the increase of personalized medicine related multidisciplinary research and innovation through the entire value chain. ICPerMed should promote the translation of research into clinical practice, and also promote the uptake of personalized medicine implementation, innovation to the market, to ensure also the access to these approaches for the patients. And of course, also to track and communicate on successful implementation of personalized medicine in healthcare systems. The impact is here shown, shortly on one slide, and there are more, it is more elaborated in the concept paper, but the overall impact ICPerMed should work for is to enable personalized medicine for the citizen. And we propose that this could be achieved via support for these axes that were already presented. So just to present the main impacts that we propose for the partnership is to really provide or to improve research and innovation towards better evidence for personalized medicine, for diagnostic, treatment, and prevention, to work towards the implementation of personalized medicine healthcare in healthcare systems, and to facilitate the uptake of personalized medicine innovation in these healthcare systems. And of course, also to develop a common language and understanding of personalized medicine for citizens, patients, and also health professionals. Well, how to achieve these objectives and to provide all the input to also achieve the impact. We proposed in the concept paper that the European Partnership for Personalized Medicine could be constructed around 4 major pillars, with the overall goal for all the pillars, which is PM implementation. All these pillars are based on a management and coordination structure provided by the partnership. And well, I would like very shortly to provide some input for these pillars and the ideas behind it. So the first pillar is joint funding. So the partnership could provide a platform for launching transnational multidisciplinary research funding, for example, ARANET-like calls. It could also launch networking calls, connecting all the different organizations together in countries. It could also go more towards calls that support the uptake of PM developments into the market. Then the green pillars are more, let's say, strategic pillars. And the first one is alignment of strategies. And of course, this is the important aspect that the ICPerMed should focus on is to develop and implement a common strategic and innovation agenda to align regional, national, European, and international agendas, personalized medicine agendas. Then the education pillar, I already mentioned it. It's important to improve the knowledge base, to support the development of educational programs and literacy campaigns, to create synergies, for example, through events, workshops, and conferences, and also to develop the right communication to transport this message to all the different PM stakeholders. And of course, it could contain also education and training activities, and help us to find a common language when we talk about personalized medicine. And of course, the last pillar is very important to support the development of policy and guidelines and standards, but also to communicate on those standards and guidelines that are already existing. These different pillars are not they have to be seen as highly interconnected. So they are not standing alone for themselves, but they are highly interconnected through this partnership. And to achieve and to work, push forward the work in all the individual pillars, we think it is important to have the participation of all European countries inside this partnership, but also of international organizations. And we sincerely think that ICPerMed could be developed as global leader in the personalized medicine field. We propose that the personalized medicine partnership is managed and coordinated and, let's say, animated by research and innovation and health ministries, regional authorities, but also funding organizations and foundations, all those that can also provide the same time funding to the joint funding activities, and also are at the correct position to take up the outcomes of this partnership and to bring them up to the higher level towards personalized medicine implementation. But of course, as we mentioned before, it is so important to include all the different stakeholders in the partnership, in the different pillars and the different activities. So here you can see a list of potential stakeholders, but we sincerely think that this list is not even exhaustive. So it might also change over the time of the partnership, and we will need the input of different stakeholders through the entire time of the partnership, and even the type of the stakeholder could depend, of course, on the activities. And this picture shows the governance that is proposed, but I would like to only use it to show how important it is that the personalized medicine partnership includes all the different stakeholders in the different activities. And also it is important to have an advice from an advisory board for the partnership that is helping the partnership to reorient and to focus the work on the most important topics, and also to adapt the work program on the current status of personalized medicine development. So this is why we think that the ICPerMed should develop well-defined annual work plans, and also, but nevertheless, should act in a dynamic way and adjust its focus area to be flexible and to adapt to the focus on the key bottlenecks that might, in fact, change over time. And as I mentioned, the stakeholders and synergies are important. So not only for the individual stakeholders, but as the Commission also mentioned, the partnership should be connected to all the different initiatives that are running, so also other partnerships. And this could be done, for example, through events where organized by the partnership, but also where the partnership is participating. But also the partnership could organize working groups. And it's important to have this external input because we need to avoid duplication. So, and at the same time, we need to learn from each other. So to efficiently use the resources and expertises we have to develop guidelines and outcomes of this partnership. And this is nearly my last slide, and it is showing, in fact, all the previous slides in one compact slide. So we have a lot of input we can bring into the partnership in terms of resources, funding, also co-funding by the European Commission, what is really an advantage. And all the know-how we already have should feed into this partnership in all the different activities around joint funding, alignment of strategies, development of education and new strategies and policies, to successfully receive our output and outcomes, and also the overall impact to bring personalized medicine to the citizen, to the patient, and to the society. So in summary, we can say that we propose that the European Partnership for Personalized Medicine would be a prime driver for developing and implementing personalized medicine by establishing priorities for research funding, by aligning personalized medicine strategies, by developing also strategies for education and literacy, and also by supporting policy development.